I'm Dr. Marc Greenstein. I'm a urologist with Advanced Urology in Sandy Springs, Georgia. I grew up in New York and then went to University of Delaware for 4 years and then went to Philadelphia for my med school and training. I actually practiced in New Jersey for 15 years and moved to the Atlanta suburbs about 2 years ago. My training story is a little unique because it's a combination of osteopathic training and traditional training. Very proud of my osteopathic background, but for residency I did an extensive training not only just in internal medicine, where I spent a year doing internal medicine at the University of Connecticut, but when I returned to Philadelphia, I spent 2 years of general surgery, including a lot of trauma surgery and intensive surgical trainings. Then I moved on to urology, where I just practiced general urology as a resident with interests in men's health, cancer surgeries, and laparoscopic surgery. So I became a urologist because when I was going through medical school, I knew that I wanted to do some form of surgical training and be a surgeon. And as a third year, you get to rotate around and do certain rotations like general surgery, ophthalmology, orthopedics, and I heard that urology was a very good field. So I signed up, and in my third year of med school, I did a urology rotation at Einstein Medical Center in Philadelphia. And these guys were great. They were happy, they loved what they do. It was a combination of medicine, a combination of surgery, a combination of cancer surgery, a combination of infertility surgery and medicine. And I knew right then and there that this was a field for me. And fortunately, the chairman sat me down one day. He said, "You're a good guy, you're pretty smart. If you want a position, it's yours." In urology, I have a few areas that I would say I have a passion for. One is pain syndromes. One of the few urologists that can actually focus on a patient's pelvic pain or chronic pain and get that sorted out for them. Other interests are advanced prostate cancer. I gotta say that when you have a man who is suffering from advancement of his prostate cancer and you have the ability to help them and make them feel better, it's a wonderful thing. And also, it's good to be a guy doctor. There's no one else out there that can say that they're a guy doctor. And so I help men with their testosterone, I help men with their sexual function, I help men have babies, and those are just a few areas within urology that I'm passionate about. So men's health is an interesting field because it really incorporates the entire body. And this is why having an osteopathic background is very important. So men's health is not just about having sex and going to the bathroom. It's about how's your heart, how's your brain, how are your muscles, how's your bones, are you getting osteoporosis? Of course, we think about urination, we think about having intercourse and stuff like that. But when I have a guy that's in my office that's in his 50s and he's just slowly falling apart because he's working too much, he's not eating properly, he's gaining weight, his libido's going down, and I can fine-tune this guy with testosterone therapy, exercise therapy, sexual health therapy, you're gonna have a happy customer. So one of the things I want my patients to know about me is that I will work my hardest to get the outcome that they need. I will make phone calls for them. I will reach out to their providers. I am their advocate to make sure that their healthcare needs are being met.